Hello, and welcome to our program. I'm Dr. Lewis Hassel, professor of pathology at the University of Oklahoma Health Sciences Center. And our program, the Digital Anatomic Pathology Academy Vignettes, is a part of the Digital Pathology Association and joint ventured with Path Presenter, designed to help facilitate education in pathology. And so I hope that this provides a little bit of instruction and edification for you. We're going to talk about a case, maybe a little bit of an incidental finding, if you will, that presented in an adult who came to autopsy. And on autopsy, we did examine the spine and discovered a particular lesion, which we then sampled and decalcified for histologic study. As you can see here, there was a little bit of an irregularity in the intervertebral disc cartilage with some extension seemingly up into the bony matrix of the intervertebral disc. As you can see, this is fairly normal appearing intervertebral disc cartilage here with, mixture of the cartilaginous elements that we see in that with some degree of degenerative change with the clustering of nuclei and so forth. And then it's just extending up here into the normal trabeculae of the vertebral body. There's some reaction here, but nothing particularly acute. It doesn't seem to have much activity going on here. It's not like this is a neoplasm of the intervertebral disc or anything of that sort. It's just altered its bony interface here to include these areas of extension up into the intervertebral disc cartilage. So this is not necessarily a traumatic herniation. It's just an extension that appears uninvolved by any inflammation or disruption in the bony trabeculae. More of an anatomical variant, at least it would appear in this situation. So this has been described and localized on radiographs from time to time. Here you see a case where multiple intervertebral discs were involved, and there was a degree of bony sclerosis in response to this degree of herniation, but sometimes it's formed this very nodular appearance, and so was initially described as a node. In fact, this goes under the eponym of Schmorl's node. But if you know a little bit more about the story, as I was fortunate to learn, one of my mentors was his student, Professor Schmorl. And Walter Putschar was his student and was actually the one who brought it to his attention. So in deference to him, I have eponymously termed them the Putschar-Schmorl nodes. Although if you go back to the original publication, not surprisingly, the junior associate was omitted from that publication. These are midline spinal herniations of the intervertebral disc cartilage. And there can be variable amounts of bony reaction. Some patients may be symptomatic, but in most cases, the patients, like our patient, come to autopsy and it's an incidental finding. On rare occasions, however, these have been identified in patients with back pain. And perhaps if you're seeing a degree of bony reaction, as we saw here, with this sort of hyperintense bony reaction around the tissue, they may be associated with back pain. So that is something to be mindful of. They are most frequently found in the lumbar spine, and they can involve multiple intervertebral discs and spinal bodies, vertebral bodies, excuse me. If they are related to an injury or something, it's usually an injury where there's been a lot of force exerted on the spine, and that is something that may be a precursor finding. So that's the summary on this particular case. A very brief look at bone lesion. as we've affectionately termed them, the Putschar Schmorl node. So we hope you enjoyed that, and that when you encounter that at autopsy or in some other scenario in your clinical practice, that it won't throw you for a loop. And you'll remember, of course, perhaps the most important lesson from this is to honor your subordinates, include them in what you're doing, give them credit for their thinking, their ingenuity, and their effort, so that their contributions are not lost to humanity, and so that you don't become an egotistical person seeking after whatever eponymous disease it is that you are after. So with that, thanks for joining me. Until next time, may you be well and wise in your diagnoses.